Decoding implantation bleeding, duration and its impact on pregnancy.
Hello everyone. Today we're going to dive into an important topic related to early pregnancy, implantation bleeding. We're going to specifically address how the duration of implantation bleeding could possibly influence your chances of becoming pregnant or experiencing complications during pregnancy. This is a crucial subject to understand as it can help you to interpret your body's signals and monitor your pregnancy progress more effectively.
What is implantation bleeding?
Implantation bleeding is a light spotting or bleeding that occurs when the fertilized egg attaches itself to the lining of your uterus. This event typically occurs about a week to a few days before your regular period would normally start. The bleeding is usually lighter, less consistent, and of a different color, often a bit pinkish or brownish, than your usual menstrual bleeding. This is an important early sign of pregnancy for many women, but it's also worth noting that not all women experience implantation bleeding.
What is the normal duration of implantation bleeding?
The duration of implantation bleeding varies from woman to woman. It can last from a few hours to a couple of days. Generally, it should not last more than 3 days. This is one way it can be differentiated from a regular menstrual period, which typically lasts between 4 and 7 days.
Does the duration of implantation bleeding affect my chances of becoming pregnant?
No, the duration of implantation bleeding does not directly affect your chances of becoming pregnant. Implantation bleeding is a symptom of early pregnancy, which means that if you are experiencing it, you are likely already pregnant. This is because implantation bleeding occurs when a fertilized egg implants itself into your uterine lining, which is a sign of successful conception. The duration of this bleeding doesn't impact your already established pregnancy.
Can the duration of implantation bleeding indicate complications?
While a standard duration of implantation bleeding is not generally a cause for concern, extended or heavy bleeding could possibly signal complications. If implantation bleeding lasts longer than 3 days, or is particularly heavy, it is advisable to seek medical attention. This could be a sign of issues such as an ectopic pregnancy, miscarriage, or other complications. Remember, it's always better to err on the side of caution when it comes to your health and your pregnancy. Understanding the implications of implantation bleeding's duration can help you discern between normal early pregnancy signs and potential complications. It's essential to remember that while implantation bleeding is a common early pregnancy symptom, not all women experience it, and its absence does not indicate a problem. However, if you have any concerns about your bleeding, duration, or other symptoms, don't hesitate to consult with a healthcare professional. We hope this video has been helpful to you. Keep taking care of yourself, and we'll see you in our next video.